Now we're going to cover the diagnostic studies. Healthcare providers are challenged daily because of the diverse signs and symptoms that are associated with an AMI. No matter which signs and symptoms are seen, if an AMI event is suspected, an electrocardiogram and biomarkers of myocardial necrosis, also known as troponin levels, are ordered stat. The CK and CKMB are also used to assess muscle injury, but the gold standard used for an AMI rule-out is the troponin level. Of course, if the EKG shows an ischemic event, the patient will be taken to the cath lab immediately, regardless of lab values. Our patient will be having an EKG and his labs drawn to rule out an acute MI. An EKG may not always show a cardiac ischemic or issues. If the patient has a risk factors but negative cardiac markers but is displaying atypical symptoms, the provider can choose to order a different non-invasive test to help rule out ACS that can lead to an MI. Cardiac stress tests can be performed chemically or on a treadmill. This test is designed to dilate the coronary arteries and exert the heart. A continuous EKG is performed, evaluating for acute changes along with recording the patient's symptoms. The stress test can also be ordered with a nuclear study, which is helpful because it will give you an image of the heart before and after stress, highlighting the heart muscle. By comparing the rest and the stress images, the physician can see if there are areas of hypoxia with the EKG and refer to cardiac cath lab if needed.